Good afternoon. I'm Lucas, co-founder and CEO of Headquartersis, where we're making best-in-class concussion care accessible to all. Imagine this. You've been locked up in your bedroom for the 10th straight day. You're having pounding headaches and unable to recall basic information. You don't know when or if you're ever going to get better. Well, this is me on not just one, but 3 different occasions after suffering from concussions myself. And I can tell you, it's truly traumatizing. I ended up in the ER and was told from there to go shut myself off in my bedroom and just wait for my symptoms to go away. So I did for a whole month, just waiting there in my dark room. Until I started seeing other doctors, went to my primary care and multiple neurologists. Unbeknownst to me, they weren't trained in the latest and greatest concussion care, and all they told me to do was to keep waiting. And so I did, for a month, and yet another, until I started to take matters into my own hands, and I learned of specialty concussion clinics that are out there, but they were nowhere near me, had enormous wait lists and exorbitant out-of-pocket costs that I couldn't pay. I'm not alone in this. There are 3.8 million Americans who suffer from concussions every year, making this a $27 billion market based off of the average insurance payouts for concussion out there. Thankfully though, just 3 years ago, new research came out transforming how concussion should be treated and hopefully making my story a thing of the past. Unfortunately though, experts estimate it'll be another 14 years until these new protocols disseminate throughout the US healthcare system. But we're not waiting. We launched in January and have already had 15 amazing pilots with great feedback telling us how amazing our service is. We additionally struck up a partnership with the largest concussion-specific insurer in the US, helping us really make this service a no-brainer, as one of our pilot users said himself. And lastly, we raised $1.8 million for our pre-seed back in April, allowing us to run for the next 2 years and get to $1.5 million in revenue over that time. What is it that we're building? An AI-enabled virtual concussion clinic made of 2 components. The first, telehealth with these concussion specialist doctors who know the latest and greatest protocols. And the second, our software platform, our AI-enabled Rehab, that makes it so much easier to deliver remotely as opposed to having to find these specialty places in small pockets of the country. How it works is the next day after you've had a concussion, you hop onto a telehealth appointment with one of our specialists. They use our AI-enabled EMR to better prescribe your personalized plan, and all the admin work is taken off of their plates, so they're focused on you, the patient. From there, you're guided day in, day out outside of your appointments by Hope, our concussion companion who's guiding you along the way and is able to adapt based off of how you're progressing along your recovery. Lastly, we know that there are 7 different subtypes of concussion, and no 2 should be treated the same way. So we have an interdisciplinary team of subspecialists who know how to treat each of these different subtypes and ensure that you're getting very personalized treatment that is aligned with the latest and greatest that most people are not receiving. All in all, it leads to a happier patient and better outcomes, cutting the chances of you having long-term symptoms like I experienced in half. We provide this service to concussion patients, and we get paid back using existing CPT codes from health insurance, $1.3K on average. The way we find those patients is our initial focus is in youth athletics, where we go to athletic organizations that staff athletic trainers. Think high schools, club sports programs, and even hospitals like UCSF we work with in our pilot. They provide these patients to us, and we additionally provide them our software to make their lives so much easier in supporting these concussion patients. And you might think to yourself, well, you must have to give it away to free or maybe even pay them to use it. Well, no, they actually love it so much they're willing to pay us $3K per year as an additional revenue stream. Now, we plan to dominate the concussion market with this model. Again, a $27 billion market, but we're not stopping there. We can apply our infrastructure, our same doctors, to expand to all of neuro rehab. Think long COVID, most topical today, or patients who are in their later stages of rehab post brain surgery and stroke. With this, we can serve so many more people in the country and across the entire globe. Now, when it comes to the concussion space, really matters is 2 things. The first is speed to recovery. We want to ensure we're helping people get back to their lives as quickly as possible. The second is accessibility. So you don't have to drive there, you don't have to wait, and you don't have to pay crazy out-of-pocket fees. We've studied the market in those 2 spheres, and we see a huge gap in the top right, obviously. We fill that gap. Now you might think to yourselves, concussion is such a niche market. There's no way you can make an enormous business off of this. Well, we are able to because we have enormous gross margins, and it'll only take 2% of the market to get to 100 million in ARR. We've got the best team to do so. Outside of having been a concussion patient 3 times myself, I used to lead teams at GE Healthcare developing new medical devices and building teams together to develop new technology. I'm also joined by Orestes, my co-founder and our CTO, who is a badass engineer who has built AI backends for startups and government after getting 3 degrees at Penn. Additionally, we have an amazing team of medical advisors coming from the top concussion clinics in the country, guiding us on the newest, latest, and greatest protocols and how to best treat this condition. Now, where we're going next is we're validating this business model after having just recently raised. We're focused first on building our team, hiring up our clinical team and amazing doctors in this interdisciplinary specialties, as well as engineers. From there, we're validating an insurance reimbursement. We just recently started striking up a conversation with a group called Bridge to help us lean on their insurance contracts to do so extremely fast. Lastly, we are validating that partnership with Headstrong Concussion Insurance to really make this a no-brainer, and are using it to help us get to 50 organizations in working with us for this fall sports season coming up in just a couple months. Now, how we'd love your help is we'd love introductions. First and foremost, like I mentioned, we're looking to get to 50 schools and clubs this fall, and if you happen to know any high school athletic trainers or club sports administrators, we'd love to speak with them. Additionally, if you know any rockstar full stack developers to help us build this amazing product and make it even better, we'd love to speak with them. Additionally, past youth athletics are looking to get into hospitals, and we want to chat with them to be able to have their ER discharge concussion patients sent to us. And lastly, any former pro athletes who have a personal tie to concussion, we'd love to speak with them. Again, we're Headquarters, and we hope you join us at the Headquarters of the Future of Brain Health. Thank you.